Have you ever experienced a persistent, nagging discomfort in your upper belly, perhaps a feeling you just cannot shake? Ulcer upper abdominal pain often feels like a burning, gnawing, or aching sensation right in the center of your upper belly. This area is typically located between your breastbone and your belly button, a region doctors sometimes refer to as the epigastric region. It is not just a general stomach ache. It has distinct characteristics that can provide clues. This sensation arises because an ulcer is essentially an open sore that forms in the protective lining of your stomach or the upper part of your small intestine, an area known as the duodenum. Think of it like a small wound on your skin, but on the inside where it is constantly exposed to strong digestive juices. When the highly acidic digestive fluids, which are vital for breaking down food, come into contact with this raw, exposed tissue, they cause significant irritation and pain. This is why many people describe the feeling as a burning fire, a dull ache, or even a persistent gnawing sensation, almost like an intense hunger that does not go away with food alone. The pain is not constant. It tends to come and go in waves, often lasting 4 minutes or even a few hours. A key characteristic is its timing. Many people find their ulcer pain is worse when their stomach is empty, such as several hours after a meal or in the middle of the night. This is because there is less food to buffer the stomach acid at these times, allowing the acid to more directly irritate the ulcer. Conversely, eating food or taking over-the-counter antacids can often provide temporary relief, as they help to neutralize stomach acid or create a protective barrier, but the discomfort usually returns once their effects wear off. To help understand your unique pain, it is helpful to pay close attention to when it occurs, what makes it better, and what makes it worse. For instance, does the pain consistently appear before meals, after eating, or only at night? Does a glass of milk or an antacid temporarily ease the discomfort? Tracking these patterns can provide valuable clues for you and your healthcare provider. If you experience persistent upper abdominal pain, especially if it interferes with your daily life or sleep, it is always a good idea to chat with a healthcare professional. They can help you figure out what is truly going on and guide you toward appropriate solutions. Did you know that the location of the ulcer can sometimes influence the pain pattern? Gastric ulcers, which are those located in the stomach lining itself, might cause pain during or shortly after eating, as the stomach begins producing more acid. Duodenal ulcers, located in the first part of the small intestine, often feel worse when your stomach is empty and might even wake you up in the early morning hours, with relief coming shortly after you eat or take an antacid. These subtle differences, while not definitive for diagnosis, offer important clues to medical professionals. Understanding how ulcer pain typically feels and recognizing its patterns is an empowering step towards managing your digestive health. By being aware of these symptoms, you can have a more informed conversation with your doctor, leading to quicker diagnosis and more effective strategies for relief and healing. Your comfort and overall well-being are incredibly important, so paying attention to these signals from your body is a valuable practice.